Laparoscopic liver surgery is one of the most complex things that has been developed over the past decade. When you look at the liver, it is like a sponge full of blood. It's got it's a it's an organ which has got complex anatomy, and as a result of it, operating on this organ is one of the most challenging things in HPB or hepato-pancreato-biliary surgery. Therefore, guidelines have been developed to do this safely. It involves again making small little cuts on the tummy, where you then pass a telescope and watching on a screen. And in my case, I've been using 3D liver surgery for the past 7-8 years, which has hugely transformed the clarity and the way we can actually deliver on our skills to remove parts of the liver. The interesting thing is that when you have a big part of the liver that has to be removed, obviously it cannot be taken out through a small 1 centimeter cut. And we make a cut right at the bottom of the tummy, which is where the babies are born from through like cesarean scars. And that is where we take out the liver from. Again, from the safety point of view, this particular surgery has been developed over the past 10 years. And I'm proud to say I'm again one of the European experts who has developed the guidelines for delivering on safe laparoscopic or keyhole liver surgery. The main risk of operating on the liver is bleeding, and hence one has to be really careful and follow the principles and develop your skills accordingly in terms of making sure that the patients do not get bleeding, because this could be catastrophic in liver surgery. The other complications people can get are infections, and sometimes you can get leakage of bile from the area where we divide the liver. And more often than not, this can be managed by conservative means by putting a tube into the bile duct, which would often stop the leakage. It's very uncommon for us to go back in and operate again. But the most common complication to avoid is actually bleeding during liver surgery. And that goes for whether it's open or laparoscopic, which is keyhole surgery. There is again no ideal candidate for laparoscopic liver surgery. It goes back to the principles. If the patient is fit to undergo the operation, if the tumor location is in a position that allows you to use the laparoscopic approach, then you would use this procedure. Again, there's not very many tumor locations that you could not do this approach by the keyhole method unless it requires complex reconstruction of blood vessels, etc. That would require an open approach. But vast majority of the cases, one should be able to offer keyhole approach to operating on the liver for removal of tumors. The laparoscopic approach to removing tumors from the liver actually gets the tumor removed in terms of whether it's a benign one, which is a non-cancerous tumor, or whether it's a cancer. And when it is a cancer, it is very relevant using the keyhole approach because it allows patients to recover much more faster and get back onto chemotherapy, which is an important additional treatment that they require for treating their cancer. When a patient undergoes laparoscopic or keyhole approach to removal of the liver, if it is a small part of the liver that is being removed, their length of stay is about 2 days to 3 days. On the other hand, even if they have had half of their liver removed by keyhole approach, their length of stay in the hospital is about 4 to 5 days. And this is in comparison to an open operation where this would be about 7 to 10 days. The functional recovery, which is the most important bit, is actually, again, about 4 to 6 weeks with keyhole or minimal access surgery versus 12 weeks with open surgery. So there is a huge difference because the scars are smaller, the patient experiences lesser pain, and is therefore able to get back onto doing their normal functional duties much more quicker. This has been shown in actually important studies that have been performed internationally that I've been proud to say that I'm part of.